Good evening, everyone, and welcome to the November meeting of the Academy of Integrative Health and Medicine's Cleveland chapter. I'm Peter Geller, co-leader of the chapter, along with Dr. Amy Cipolla, who was unable to join us this evening, and Dr. Jacob Wolf, who is able to join us and is right here right now, and is handling the tech end of things tonight for us. We are really excited, actually, to be hosting tonight's panel, which we've entitled Envisioning Integrative Practice, Hopes and Aspirations for the Future of American Medicine. I think it's fair to say that this is a topic that is of interest to all of us in the IM world, and probably anybody else who's got any kind of concern about the future of medicine in general. And we probably could be listening with interest to any number of speakers expound on their visions for the future of the field. But what we've chosen to do for tonight's panel is to seek the input of some people, outstanding people, who are on the cusp of their medical careers. 3 medical students, and we actually did have a first-year medical resident about to join us as well. But this being the real world, she was called to a labor delivery right now, and so she can't join us, but we still have our 3 medical students. I'm just going to introduce them very briefly, just by name really. And we have Dr. Lily White, who is moderating the panel. This panel is actually follow-up on Dr. White's presentation, individual presentation last month on the direct primary care model, the alternative model for family medicine practice. And Dr. Lily was talking to us about the model and about using the model to set up her own ideal family medicine practice. And so we wanted to invite some physicians in training to talk to us about their aspirations for practice, and as well as their visions for the future of the field, how it might be transformed for the better, and all that kind of stuff. So we do have Fiona Fragaman and Serena Lee are both M3 at the Case Western Reserve University School of Medicine. And we have Jamie DeChico, who is an M5 at the Cleveland Clinic Lerner College of Medicine. And these are all brilliant and articulate and visionary people. I call them visionaries. And so, like I said, we're really excited to hear from them, and I think you'll all be very interested to hear what they have to say. So without any further delay, I'm going to hand the floor over to Lily.
Hey, thanks, Peter. So for the kind of format tonight, we'll just take about 15 to 20 minutes per panelist to please share your story with us. And then at the end of that, we'll have a chance to go through question and answer. So if you think of questions while they're speaking, please feel free to pop them in the chat, and then we'll come to them at the end and go through some questions. So now without further ado, I'll turn it over to Fiona first, and then we'll just make our way around.
I figured I would start. Alrighty, so hi everyone, I'm Fiona Fragaman. I'm a 3rd-year medical student. I'm really excited to be here this year. We did a similar but different format last year where I was able to speak. So this is nice having other peers who are experts in what they want to do and how they want to see medicine change. So a little bit about me. I've always really wanted to go into medicine since I was a little kid. I was exposed pretty young. My parents are both in the medical field, and that interest more significantly when about 10 years ago now, actually, our family really changed our lives, and we found functional medicine first, and then started adopting some more integrative medicine practices. And that really shifted my perspective on how I want to practice in the future, and how I wanted to, up until my training, kind of discover aspects that I think were missing in medical education. So fast forward, in college, I studied nutrition. majored in nutrition and biochemistry, metabolism. And there I learned pretty decently well what we should eat. Although there are some things that I may personally disagree with in how they teach nutrition. Overall, that's kind of what I learned, along with my like personal interest and our family's interest. And then that shifted a bit into, okay, what you eat is really important. However, where are we getting those foods, right? How are we cooking those foods? And so that led me to, I'd always had an interest in agriculture a little bit. I'd worked at a garden for a long time, volunteering there. And that sparked interest in like watching documentaries about agriculture. And I found one called The Biggest Little Farm. And that really inspired me. And I ended up working as an intern for a summer there and learning a lot about regenerative agriculture. So that's where I started realizing, it's not just what you eat, but the kinds of foods you eat, the quality of meats that you consume, and then, having your garden, eating locally, with minimal to no pesticides, especially in regenerative agriculture, considering the earth as a priority and then animal welfare as a priority. And those things really spoke to me. Then like I was saying, I kind of transitioned to, okay, I have a little grasp on how you grow said food. Now, how do you make it? So I did a healthy cooking program at the Culinary Institute of Barcelona. And there we learned a lot about like using foraged items or using local produce to make delicious meals, and make healthy food, which has this stigma that it doesn't taste good, tastes good, right, from a chef's perspective. And so getting rid of that misunderstanding. And so when I started medical school, I came in with that kind of background, and I knew a little bit of what I was getting into and like maybe some of the frustration I would face in how we were taught. That then led to me kind of exploring, okay, what does nutrition curriculum look like in medical education, which is pretty minimal. And even CASE, which has pretty good nutrition program historically and currently, definitely we can all do better. And so I ended up co-leading a food as medicine course with one of the other medical students, Connor. And we brought speakers from all around the country, brought Fred Provenza, Terry Walls, Will Harris, and those people are in farming, in holistic medicine, just to introduce these topics to medical students who may be interested. We had incredible interest right away, 40 students interested, most clubs, it's like 20. So for perspective there. So since then, I found it to be a little difficult to be able to integrate my learning with my learning of holistic medicine as well. However, I've noticed that now in my third year, as we rotate, that it's so important to have that background. And I see physicians struggle all the time. And when patients ask, what else can I do, right? And that was my experience with my pediatrician, right? And that's the experience of most people who don't have Dr. White as their physician. And so that is, for me, I didn't want to be that kind of doctor that wasn't literate about these topics. And I mean, I'm really passionate about it, so I'll always be learning. And this field is just really necessary in how we practice medicine right now. How most people practice is symptom management, attack one problem at a time, not considering root cause, not considering traditional practices that have been brought through generations for thousands of years, and the impact of mind, body, spirit, right, in how we take care of patients, which, you know, ultimately your symptom is one aspect of your whole life. So thinking about patients more holistically. As I say that, I also have interest in pursuing surgery, which is not a very typical field for that lends itself easily to holistic practice. And yet it probably needs it the most, right? Most physicians that go into surgery, they like a quick fix. They don't really, they're like, oh, consult X service for every other symptom that has nothing to do with their hernia repair, right? And so I want to be someone whose practices differently. That's kind of my goal. Someone who considers the whole person, because patients care about that. I'm currently in my surgical oncology rotation, and I've had patients who, I'm in a public hospital, patients who maybe don't have the highest level of education. They're like, I heard there's stuff in food that's making me sick, and do you think that's why I have cancer? They're asking questions like that. People want to know, and the physician's like, well, I can't really speak to that. And that is, I mean, yes, you cannot be an expert in everything, but you should be able to connect people to in the right direction and speak somewhat to what's happening in someone's health in general. And it's very applicable. Carcinogens do lead to cancer, right? And so to not know that as an oncologist is, although surgical, is I think irresponsible a little bit. And so, yeah, I mean, that's kind of my story, a little bit where I'm at. What was the other? Hopes for the future. I kind of spoke to that, but I mean, my dream would be to have some kind of surgical clinic, outpatient clinic space where it would be on a farm, and we would have chefs, and we would have psychiatrists, and we would have holistic medicine people like doing acupuncture and massage therapy, and you would have all of that in-house and have like an experience for a patient that they can really seek integrative, truly integrative care that aligns with my personal like practices and how I would want to be. And right now, I think a big issue in medicine is that everyone's so disjointed. Even though we have teams in like that I see in my surgery rotation where you have medical oncologists, radiation oncologists, you have plastic surgeons, right? That I've been doing a lot of breast, so that's the team usually. That those people are communicating, but they're only communicating about the symptoms, and they're not communicating about the whole person. And that's what that would be my dream. I don't know if that answers the question fully.
Yeah, great. Oh, thank you so much for sharing, Fiona. Lovely. All right. Serena, would you like to go next?
Sure. I feel like Fiona touched upon a lot of awesome points that yeah, totally agree with. Yeah, so I'm Serena. I am from Southern California. I'm Korean American. My parents are from Korea. And I say that because that's part of my exposure to integrative medicine and Eastern medicine, is because in college I sprained my ankle, and the inflammation wasn't going away no matter what I tried, rest, therapy, all of that, and meds. And then my mom kind of, as a last resort at that time, took me to Korean medicine doctor, who did acupuncture, moxibustion, some other things as well. And that seemed to be one of the only things that really helped with my inflammation at the time. and that kind of made me really curious. I was I think a junior in college at that time, and I knew that I was pre-med, and I had been learning about um like public health issues and issues with our healthcare system in terms of, like Fiona said, the fragmentation of it, the lack of primary care, the lack of access to quality care. And then having this personal experience, I was kind of like, this is interesting. I just wanted to know more. So I ended up doing um, uh, for a class project in a study abroad program, kind of tried to delve into uh, traditional Eastern medicine, traditional Chinese medicine, um, to understand sort of uh, what elements I felt like were helpful and useful to us, and maybe what elements need to be worked on, and also the barriers that I would say like traditional medicine faces in the Western Hemisphere. And um, it's very multifactorial, as many of you know. But yeah, I um, did that presentation on my research project, and I remember one of the judges who was um, a doctor who just was really against everything that I was sharing, and it was really disappointing. Um, but I think I think to me the things that this doctor brought up just made me realize that um, there are a lot of things in Western medicine that we kind of just accept for granted, and we just say this is sort of the right thing or the right way to go about medicine, and we don't consider that, like Fiona said, like there are so many things that are connected to each other. I think we do miss out on how disease can just be um, so multifactorial, and also related to a lot of times mental health as well, and trauma and all of that. So yeah, I that was one of my first exposures to integrated medicine. Um, and then uh, before I came to med school, I wasn't sure about what specialty I wanted to go into. I was scared of primary care and scared of family medicine because everyone was telling me like you're gonna get burnt out. They overwork you, they underpay you, all of that. So I was kind of conflicted because I did think that my values of like holistic, comprehensive, person-centered care that aligned more with family medicine. Um, uh, just I it felt like it was not the wise decision to make at the time when I was learning about it. And then um, I read The Price We Pay with some of my coworkers, um, which is a book on why American healthcare is so expensive. And that was my first exposure to a direct primary care model, where well, it was actually employer-based direct primary care. But when I was reading about that, it was kind of like a light bulb moment for me, where I was like, it is possible to practice this type of holistic care and also not get burnt out, and also not like, yeah, have to feel like you're going up against insurance all the time and suffering, and seeing your patients suffer and all of that too. So for me, that was like definitely life-changing in a lot of ways. And since then, I had been just trying to find more people and more spaces that, kind of uh, also care about these issues and these things. And um, I had the privilege of being the family medicine interest group leader with um, Connor at our school. And through that, we were able to put on multiple events about DPC, but then also do an integrative medicine workshop type of event in which Peter, Lily, Jacob, Amy, they were all there, and it was a lot of fun. But yeah, it's been a joy to um, just be able to tell my classmates about these amazing ways that we can practice medicine that, at least for me, give hope to what seems to be just like a really broken system and a really harsh and difficult system to work with, that patients are not benefiting from. And so, yeah, that's been a lot of fun. In terms of what I would want to focus on in the future for me and my career, for a long time I was family medicine, and I still am thinking about it, but I am in my 3rd year. I've been, exposed to different rotations. I didn't realize I was an adrenaline junkie as well, so I loved actually like OB-GYN. That was exciting, which you can also do with family medicine. But right now I'm on neurology, which I'm actually just absolutely loving. I was a neuroscience major in college as well. I didn't realize this would be like super fun for me. So we'll see what happens. However, I think um, some of the things that I know that I wanted to focus on in terms of the way I practice medicine in the future was through DPC, but also focusing on like Asian and Asian American health. I think in our medical education, we don't really learn at all about that population and in terms of like the specific health issues that they go through. And there are definitely certain, like for example, cancers that are predisposed in those populations that see and hear from my community a lot, that I just don't learn about in med school. And so I think I would love to bring in like traditional Korean, traditional Eastern medicine into my practice as well and make it also just like a more culturally informed practice for Asian and Asian American populations. So that's one of my passions, I guess. I think that's it for now.
Yeah, no, thank you so much for sharing. I'm hearing a lot of great activism so far and some really good dreams for the future. So I'll turn next to Jamie and we'll let you take the floor.
All right. I have like a little presentation. It's not anything special, but
Please.
I'll share my screen.
Looks good.
Okay, great. So yeah, I'm Jamie. I'm in my 5th year of medical school at the Lerner College of Medicine. So we get like a bonus research year, so that's why it's 5 years. But I'm currently applying family medicine, so in the application and interview process, which has been really fun. So excited to see where I'll end up. But some background on kind of my story with medicine and real exposure to integrative and functional practices. Yeah, really wanted to do medicine probably since middle school. I just really enjoyed school. So that's kind of where I started to do more like science projects and really get into it. So coming to college was pre-med and focused on neuroscience and psychology for my majors. And was also an athlete. So I was really, invested in nutrition and like sports nutrition and how that impacted performance. And then through my senior year and gap year, did research in like sports medicine and concussion space. So I worked with a physiatrist, so PM&R doc, and he was a DO. So I feel like his approach to medicine and practice was very holistic. So I kind of got some exposure there even without realizing it. But we would address all these lifestyle components that were contributing to their recovery of concussion. And then also he would perform some like osteopathic manipulation on a lot of the patients. So got a lot of just exposure there and kind of some ideas of how I wanted to practice medicine. So that was what I thought I wanted to do coming into med school was physical medicine and rehabilitation. And then in med school, my sister, or before med school, but then, throughout med school, my sister got really sick. And so seeing her go through that was also really like changed kind of my trajectory, and involved a lot of, GI, and nutrition was important. And so that's something I had always been interested in, but I feel like was really highlighted and was a stronger focus during that time and helping her through that. And then kind of with Fiona, since you're interested in surgery, I thought that was cool since, I really got into surgery since my first year of med school and thought that's what I wanted to do up until like third year, and was, how did these components of like integrative and functional medicine kind of fit into a surgical career? So I was kind of struggling with that, but was, enjoying the research that I was doing and seeing it impact, patients like my sister. And, meanwhile, I had also found at the beginning of second year med school, CrossFit, which also teaches a lot of not just like physical health, but nutrition and community. So a lot of other health components there. So I feel like that was growing some of my holistic health. And then during my second year of medical school, I also got sick. And so having to face kind of, I thought I was so healthy and had never really struggled with that. And so having to, be like what I was really healthy. And now I'm having to kind of face my own health and find more non-traditional routes of healing. And so at the same time, I had friends, for example, going through, I have one who's has RA, so rheumatoid arthritis, so going through some autoimmune conditions. And so we're kind of like all on this journey together, and using different forms of care to really find healing. And so, yeah, I think those were like some just great exposures. So I think seeing my sister, she had, really had to use a lot of conventional medicine, but then also found a lot of support through other integrative and functional components. And then after getting through initial like surgeries and things like that, has really worked with other like holistic doctors afterwards to provide some that like bridge to healing. And then with my own health, like I really just primarily used more of like integrative and functional medicine to really get to a much better place. And then throughout med school, we also get to do a master's with our program. So I chose to do the clinical research master's, but took basically all but one nutrition course for the master's for that one as well. So I was able to get a great nutrition education through CASE. And during my fourth year, I took a functional nutrition course and ended up working with one of the dietitians with her company, which was just really great to see how like she was able to help patients in such like tangible ways. And I did some like research for her and putting together just like packets for patients and kind of the science behind the nutrition. So we focused on different topics like home cooking, culinary education, whole foods, ultra processed foods, calorie counting, different macronutrients. So the qualities of our proteins, fats, carbohydrates for blood sugar balance, the benefits of using organic ingredients, the benefits of different herbs and spices. So covered a lot of different topics with that, which was really fun for me, but also like really valuable for patient education. So, and through that process, that's where I was really like, okay, because I wasn't quite sure on a specialty yet. But through that process, I was like, okay, I think I can really do what I want to do and how like practice the way I want to through family medicine. So that's kind of finally when I decided, since I loved everything, was still considering surgery, and was doing my research year in surgery. So, and now we'll kind of get into my presentation with how kind of focusing on the healthcare system and then how I want to practice. So, so I really see like you guys talked about some of these, but really like challenges in our current healthcare system. So, coming into medical school, I never thought honestly, family medicine was the last thing I thought I'd be doing. And a lot of it was due to like time restraints. So just like really short visits with patients, and how much can I actually get accomplished there? And I'm really just kind of touching surface level things, treating symptoms. And it's almost kind of like a conveyor belt where you're just trying to get patients in and out. And there are helpful algorithms, helpful things that we follow in medicine. But it's not really treating like the actual person, the whole person, just the symptoms on the surface. So time's a big issue, cost for patients. I guess also with time, like the appointments book out so long. So patients like they're short appointments, but they can't even see you for like a year. So that's always an issue. And then, yeah, just the cost for patients. So, really expensive treatments, visits, and they're not really getting too much out of it, and they're still dealing with all of these symptoms. And then with cost, insurance limitations for both the patient and then also the provider and what we're allowed to do based on the patient's insurance. And then, yeah, just really our approach to care and the forms of care and treatment that we're allowed to do, depending on like what medical system you're working for and the constraints there. So how we really think about disease, I love this diagram I took it from IFM, but I think it's really helpful just to simply conceptualize. So I feel like how we currently kind of practice in the medical system is looking at signs and symptoms and then just kind of dividing things out into organ system diagnoses. And so if you have an issue with the nervous system, you go see neurology. With your GI tract, you'll see gastro. And so it's kind of broken up into all these different components where really, we're a whole person and all of our systems are integrated together. And so what, the more functional integrative medicine approach is looking at that underlying cause. So thinking about what's the root, what's causing it. And then how I like to think about it is identifying kind of the underlying problem and then to be able to address what's going on. So how can we either eliminate the things that are contributing to like poor health and how can we optimize and actually create health? And that might look different for every patient. So it's something that can be really, we want it to be sustainable for the patient. And so basically, I feel like my approach and how I want to practice is really to optimize each patient's quality of life. And they're going to have a unique situation, unique conditions, different genetics, different environments that they're living in, and different things they can actually integrate into their lifestyles. And some patients really do need, and I'll touch on the patients I want to treat, but really do need a lot of conventional medicine. And some patients might be able to, completely remove that from their lives. So it's really a range. And so approaching each patient with their unique set of symptoms and conditions, personalities, just life experiences and everything they're going through. So we'll zoom into this to explain it a little bit more. So the way I think of kind of health and wellness, so I took this from CrossFit actually has a sickness, wellness, fitness continuum. So I really love this model. So we well is generally like where we want to be, but with the mentality with CrossFit is trying to get into the fitness. So you have a buffer, so you go through wellness before you actually end up sick. And so they have their measurements based on kind of more like things you can measure, and it's more like physical health. But I think there's so much more to our health and wellness. And so it's not just the physical, it's kind of our mental, emotional health, our spiritual health, which I think is personally really important to me. The environment we're living in, the social relationships and the community we have, what we're doing for not just work, but kind of our purpose. And then there's other financial or intellectual components of health. So obviously this isn't a perfect wheel, but it was just one that I found thought was a good example. And so I would put all of these things kind of in this continuum as well. And we might measure them differently depending on the person, but something I has helped me frame how I want to approach patients and what can we do to get them well, but then also optimize their kind of life fitness. So, and then these models are kind of similar with different components, but this is more like the actual integrative medicine components. So what do we do to actually address those aspects of health? So in my practice, I think I always want to have this overlying picture of what is how's the person's soul doing? How are they actually doing? So that spiritual care is really important to me. And then their communities and relationships. So I think those are some of the most important aspects of our health. And then optimizing nutrition, which Fiona talked about so beautifully. So that was really cool to hear. And then with that, supplementation, because maybe due to genetics or even just the quality of our food, we may be lacking in certain areas. And then also use supplementation in certain disease states to help movement or physical activity. So it may not be the intensity of CrossFit might not actually be good for a lot of people. So what types of movements would be helpful? I not only sleep, but just rest is important. So how do we rest well? Not just the quality of our sleep, manage stress, and then some other those are kind of overarching categories, and then some other specific techniques that I've had some personal experience with would be things like biofeedback. So I'll touch a little bit more on that as an example with how I want to practice. Some more hands-on techniques. So since I'm in an MD program, we don't actually learn OMT. So I know anyone who's been through DO schools, fortunate enough to have that. So I think Lily was able to learn, or Dr. White was able to learn a lot of that. But that's something I'm looking for in a program to be able to learn. And then, I have like used cupping, grass or scraping. That was something I used a lot like during college with athletics, and then even now. And then I love like sauna. So just a lot of different like more integrative components that I want to be able to offer as advice to my patients. And then something I wanted to touch on too was just the research component. So I think that's often not talked about in this space. It's something that was a big part of my education, and something that I've really enjoyed doing, and just seeing the impact that research has on our actual patient care. And so part of the way I think about this is important, especially in this space, because at first I'm like, we really need, like, we know how to eat, just eat real food. Like, we really need these like trials to show us that like real food is better than this ultra processed food. Not really, but in thinking about it on a larger scale with like legislation, and funding, things that are provided. I think the evidence is actually really important to change certain like laws, or certain funding that's provided, food that's provided to schools, or subsidized and things like that. So thinking about it on that scale, it actually is important. And really, I've seen just in the research that I've been involved with, just how it actually changes patient care. So I think that's just something for us to think about. And even if we're not performing like randomized control trials, but actually documenting and putting it out there, how we're treating our patients, and then the like changes that we're seeing, so that, other people can start integrating that into their practice. And then if it gets, large enough, then actual change can be made on like a much larger scale. So kind of wrapping up with what I want to do for my future practice. So with family medicine, I'm going into that because I would love to treat a wide variety of things, but something specific that I would really like to treat are patients with these complex conditions. So this is kind of what pieces of this have been like what my sister, friends, and I have experienced. And so what started off my research, my first year of medical school, was focusing on these compression syndromes. Specifically, the one I kind of focused on throughout medical school was median arcuate ligament syndrome, or MALS. So it's compression by the diaphragm on the first part of the abdominal aorta, causing there's debate whether it was like a vascular condition, so causing intermittent mesenteric ischemia, so kind of like a heart attack to the GI tract. And then, there was some speculation for a neurogenic component and neurogenic etiology of this. So that's actually what my research focused on. And we really actually, took samples from surgery and worked with pathologists to show that there was chronic neuroinflammation and fibrosis occurring and immune system activation. And so typically this is treated surgically, but I would really love to be able to treat it a little bit more holistically, and then, maybe even prevent surgery, because you can have the compression without actually having symptoms. But there's often some sort of trigger. So often I would see maybe like a viral trigger in patients, similar often to something like POTS, for example. So that's been a big focus of mine. And like, I've just seen how actually discovering like something that's causing it is impacting the care we're providing for our patients. So I'm going to go through these and just an example of how I want to address them a little bit more holistically. So for example, patients with MALS or other compression syndromes may often need enteral nutrition, so feeding tubes. And so my sister, she was the first feeding tube she was on before her MALS surgery. She was on a nutrition formula that was basically probably just like corn syrup and I don't know what else, but very low quality nutrition. And then before, she also had another compression syndrome, so she had to get a second surgery. But with that one, she was on a different formula that was plant-based and had like actual fruits and veggies in it, and just so much more quality nutrition. And even though she weighed a little bit less, she looked so much healthier. She felt better. She had more energy. And so I think that's just an example of the importance of nutrition, even in formulas we're giving to patients. And so I've even taken that into other rotations I've been on. I was on like a pediatric comprehensive care rotation, where those patients are so reliant on all sorts of medical devices, and most of them are on feeding tubes. But I would have patients, come and they would be suffering with a lot of GI issues, maybe like constipation, even something a little bit more simple. But they would switch to higher quality formula, and their GI symptoms would go away. So I'm seeing it, not just in these complex patients, but across the board. So that's just an example there. Often patients have all these things, so it's kind of, I want to have like a care of excellence clinic for these patients. But another would be kind of the dysautonomia umbrella. So for example, POTS, postural orthostatic tachycardia syndrome. So something I've seen be really helpful for this population. Obviously, all components are helpful, but something is biofeedback. So focusing on breathing techniques, and then also how we're activating our muscles, and certain like exercise protocols, and building back up your ability to tolerate movement. So that's been really cool to see. And I've worked with Dr. Wilson at the Cleveland Clinic in his neuromuscular clinic. So he and his psychologist, Dr. Hayburn, do this a lot with their patients, which has been really cool to see them integrate a lot of these more maybe non-traditional practices, and see patients improve over time. So that's been cool. With mast cell disorders, so something like MCAS, so mast cell activation syndrome, foods, we can, if they're high in histamine, adjust those, and then supplements to help if they have some sort of like DAO deficiency, or just a high histamine load. So certain supplementation can be really helpful. And then patients with hypermobility. So for example, EDS or Ehlers-Danlos syndrome, seeing patients go through physical therapy often. So these patients are more hypermobile and may not have as much muscle tissue, but if we're able to build that up, it can help actually keep like their joints in place much better. They'll have like fewer subluxations, and or with the physical therapy, we can incorporate some like more hands-on modalities. So whether that's acupuncture, massage, small chiropractic techniques, or OMT. They're just like examples of different ways I would want to integrate those things into my practice for these patients. But really, a lot of these patients will still need a lot of conventional treatments, medicines and things like that to help them. So while we're either bridging them, or they have to be on those things, how can we also enhance their quality of life with these other integrative and functional components? So that's stuff there, but that's kind of some of my mentality experience, and then some of how I want to practice.
Good. Thank you. It's so nice hearing each of your stories, and how either our own experiences through health, or having friends or family go through health experiences, can really inform our own journey as future physicians or healthcare practitioners. So I'll go to some Q&A here. So we've got a question about Ayurvedic medicine. So Chantel says, I found Ayurveda being the deepest knowledge of diet for our body and our health. Have any of you studied Ayurveda, or any thoughts on Ayurvedic diet?
I haven't did too much. Actually, in my healthy cooking program was when I was most exposed. We did 3 or 4 weeks of just Ayurvedic medicine, learned about the different doshas and how each body type should eat. I became really interested in exploring that, and possibly, after my medical education and maybe during my residency, like exploring that further. Specifically, I think that what I found in how like the US thinks about like alternative practice and then Eastern medicine is that there's not one right way. I think that all of them offer each one offers something unique and important, and generally has similar principles with slightly different interpretations is the biggest thing. I don't think that necessarily like Ayurvedic medicine is the only way or the like pinnacle of healing, right? I think that you can get a lot of healing from all different perspectives. But I do think it is very interesting. And there's a lot of overlap in how cultures and how we think of nutrition and healing overlaps a lot, from what I've seen.
Feel free if you have other questions, pop them into the chat. I love Ayurveda, so cool. I don't know if any of you, well, for those of you that have met Olivia, whenever I think of like Pitta energy, I think that's just like Olivia in a nutshell. I just like love her, her Pitta energy. So fiery. Awesome. So one of my questions I had for you was, how do we continue, or how do we introduce more students to integrative and functional medicine? I'd love to hear your thoughts. It sounds like you've done some great work already, especially Serena with the workshops you were doing and Fiona with the culinary medicine group. But I'd be curious, like, how do we incorporate this either more through medical education or in terms of interest in practicing in the future in functional and integrative medicine?
I'm actually really curious as to whether DO schools have maybe more exposure or like a better approach to this in their medical education, because I feel like for it to be incorporated in like MD programs, I honestly think there has to be some form of, or like a change in philosophy almost within medicine in order for it to kind of like actually come into play in our education. But yeah, I mean, even when I did the integrative medicine workshop at school, there were clearly a lot of people, especially like um folks of color who, come from these different cultural backgrounds, and when they attended our workshop, they would be like, "Oh yeah, my mom, like I remember, she used to bring this herb," and like they have that exposure already in their homes. And so it's definitely I don't know, at this point I see it as more student driven because I don't know when it'll be actually a part of curriculum type of education. Um that would be awesome if it was, but I think there's a lot of just because the way that integrative medicine has come together. Yes, we try to be evidence-based as much as possible, but there is that reputation of kind of like from the Western side of things that it's um not as robust or whatever it is in terms of the research. And so like Jamie said, like I think unfortunately, even though a lot of it sometimes seems common sense, we do need to do more research just so that we get a buy-in into these bigger institutions.
I think it's like Serena said, I guess I'm a little bit not extremely optimistic, at least in the next 20 years or more. I think that medical education, I mean, this, it sounds a little crazy, but it's kind of true. Medical education is very tied to money, and that's tied to pharmaceuticals, and that's tied to insurance companies. And when you start going against that, people are going to shame you and make you feel othered. And I think that has happened a little bit to integrative functional medicine and like alternative approaches. It's working with the current system that may lend itself to slightly more education. However, it's hard to imagine that you can work within said system. And it's kind of unfortunate. And I mean, it needs to, even as a student, I've tried to make changes, and that's ruffled a lot of feathers. and has like forced me to take a step back a bit from my desire to change things, which is a bit unfortunate. And I have that little Pitta energy as well, not as much as Olivia, but however, I think that it requires students and to speak up, and future physicians and people in the medical realm to speak up. But you know, it's really hard. My friends, the majority of people in our class, I mean, I'm sure Serena would agree, think that it's hocus and like all these things are ridiculous, despite things being so logical, right? Like sleeping more. How is that so crazy, right? Or working on your mental health and your spiritual health and meditating. There are things that seem so obvious. And despite even though, you know, medicine is like, oh, we're so evidence-based, there are so many things that are not, and people do them, and like there are some crazy experimental surgeries that people do, and there's like not really any evidence. So like, we're gonna wing it. And how is that different from someone being like, oh, let's integrate acupuncture into like your cancer treatment, right? Let's bring other traditions and cultural practices into your patient care. I don't know how that's hurting someone more than some crazy experimental thing, you know? So it's a bit hypocritical, I think, at times. And I think that is due to the system and the money, follow the money situation.
Yeah, I just wanted to follow up on that because I've heard people say like, you know, like if there's no evidence for it, then like you shouldn't do it. And they're so adamant about that type of thinking, like you said, Fiona, when in reality, there's so much we do in medicine where it's not necessarily backed up with RCTs for everything. And yet we kind of just take it for granted. We're like, yeah, let's, you know, that whatever. But yeah, and I think money is probably a big part of that too. My opinion is that if it's not harmful, if we know that it doesn't harm the patient, and it's a practice that could potentially be helpful, especially, you know, coming from these long-standing traditions, then, you know, and the patient is like looking for another solution. I feel like I would want to support that patient in that. But that's my personal opinion. And then also just following up on, yeah, the idea of what you said, Fiona, like sleeping, it seems like it doesn't seem that radical, but also just medical education and the way that it is probably everywhere, but also especially in the States, is just that as students, as residents, we're not encouraged to follow those health, just like healthy things, like living a healthy lifestyle within our training. And I think it's really sad and ironic that that's the case. And I think that's probably why these things aren't popular amongst us either. It's because to us, you know, like we see the value in it, we see the self-care, but like I think a lot of my classmates would think that it just gets in the way of their ambitions and whatever they want to do. But yeah, I think we know that long-term effects are actually pretty harmful, and we're not setting a good example for our patients, in my opinion.
Just to put a slightly positive spin, I feel like throughout like the country, especially like US, throughout the country, I feel like it's really lacking. I think Case and like the Cleveland Clinic are trying in some ways. So I do feel like they've integrated some more like nutrition into their curriculum. So one of my mentors who I've worked with actually my first summer here, and then she was on my thesis committee, Dr. Kreshe. She's a registered dietitian and then also has a PhD and does a lot of research, but she's given more nutrition lectures to our school as part of our education. And then we also had during third year more of a nutrition focused didactic day with some it wasn't like necessarily integrative functional medicine, but just more like lifestyle components with some cases. So that was encouraging. And then I feel like a lot of it is coming from like students, but I think Case has that like nutrition pathway or like culinary medicine pathway. And Dr. Harris, who I've taken some classes with in the Case like nutrition master's program, leads a lot of that and has done some work with like cancer patients and nutrition. So I think it may be a little bit better here than other places in the like other med schools in the country. So I think there's some positives, especially within Cleveland. So
Love it. I was listening to a podcast today by Hidden Brain, and they were talking about how a diversity of emotions is helpful. So we got some good diversity of emotions here. I love it. We have time for a few more questions, right, Peter? Okay.
Oh yeah,
perfect.
we have a half an hour if you want.
Okay, that's what I thought. I just wanted to make sure.
Yeah.
Okay, so I have a question in the chat here, and then I've got a few more Q&As. So from Anne, she said, can we get insurance companies on board? Can nutrition become a mandatory subject? What do you think? We touched on it a little bit.
I would love for that to be the case. I think one example that comes to mind is I remember like my first year, we have a longitudinal clinic, so it's a primary care clinic, and I was seeing patients, and I remember seeing one who was in like the pre-diabetes range, and like based on her A1C, and she was asking about nutrition. And so we did some like counseling in the appointment, but I was, asking if she had ever seen a dietitian before. And she hadn't, so I like suggested this to my preceptor, and she was like, oh, well, that's actually not covered until she actually has diabetes, like based on like insurance coverage. And so it just seems so like it's very backwards to me. I'm like, why don't we prevent them from actually getting to that point? I think again with insurance, it's like a lot of it I feel like goes back to how do we present it? Is there evidence for it? Will we actually it's weird with insurance because it's like they want you to save money, but really do they? I don't know, but essentially it would save the healthcare system money, but I guess you would be like maybe not putting them on additional pharmaceuticals. So that's a whole, controversy within the healthcare system, but I feel like that's just an example. I would love for it to be a component of like play into insurance and actually support nutrition intervention. I think there have been some positive a shift. I think there is more. I think part of like a gym membership might be covered now under some insurances. So there may be some shifts for certain insurances, but I think it probably depends on which company you're with.
Also, just because this is a DPC follow-up, DPC I think would allow doctors to be able to incorporate nutritional counseling just based on the time and the financial model. So
yeah, I think that's a great point. Yeah, I was gonna say it's we think of insurance, but if you think of car insurance, we wouldn't use our car insurance to do an oil change or preventive things on our car. We use our car insurance for expensive, unexpected expenses. So it's kind of interesting with health insurance. We really kind of want to use it for everything, but that also makes costs go up. So interesting phenomenon. Okay. And then let's see, next question is, have any of you heard of muscle-centric medicine and the importance of building muscle mass for metabolic health, immune function health, and combating chronic disease as we age?
Yes, I don't know if you've heard of Dr. Gabrielle Lyons, but she's like very like big into like the focus on muscle and muscular health for overall health. I don't agree with like everything she says, but I think a lot of it's good. And so, yes, I think muscle is super important. And just especially, I feel like so many of our health issues in our society today is very much related to like glucose and how our bodies metabolize blood sugar or like sugar and how that affects like our blood sugar. So, not only with like diabetes, but also like our brain health. So I think that's something that's super important. And so anything that we can do to build more muscle will really improve our metabolic health and how we use the food that we're eating. And then also, thinking like longevity, especially in women, but even as anyone who ages, like we're losing muscle mass as we age. I think after age 30, you're really like losing. So building that up when you're young and then trying to maintain that. But you can still build when you're older, just be harder. And then preventing falls and keeping our bone mass. And then also it is really great for the immune system. So if you think of it like exercise is more of like a positive stressor, and then the things that your muscles release when you're exercising. I think there's been some research on, for example, like IL-6 and like glutamate, but there are a lot of other like molecules that are released, but those are like just examples of how those interact together and actually boost our immune response and provide protection for our immune system. So I think it's something that's really important, and I especially just being interested in more of like that like movement or sport type medicine as well. I think it's really important for patients and longevity and overall health.
Yeah, I agree with all of that. I think a lot of people get scared by protein. They don't know how to broach the topic due to animal versus plant versus this versus that. And so they're just like, oh, eat whole foods. And then they move on. And I think when it comes to this topic and building muscle, protein is necessary. And unfortunately, animal protein is more bioavailable, period, than plant. And not that plants aren't great. Like I think plant protein is also important. And so as you age, ensuring that you're eating enough protein. I think a lot of women don't eat enough protein, unfortunately. And with the sarcopenia, which is the breakdown of muscle, that plus low amounts of protein, plus maybe more cardio, less strength training practice is like a triad that is really unfortunate and to disease. Or at least keeps you sick, right? And so focusing on muscle health as you get older, postmenopausal, making sure to eat good quality proteins from a nutrition perspective and manage stress, which is actually a component of that. And then how you exercise, and when you eat related to how you exercise. I mean, this is like a whole lecture on itself, but that is something that, I mean, yes, Gabrielle Lyons, you have Andy Galpin, those are people who are experts in muscle building. And, I think for women, it's more difficult than men just because of the decrease in estrogen. And, I think women just shy away from protein more than men in general.
Yeah, I actually have a great example of that from clinic. So I think in general, I would be more of the camp of, I think animal proteins are great, but I think it's very individualized. Some people do really well on like a vegetarian or vegan diet, which is totally okay. But I think nutrition is very personalized. But I had a patient, she was I think she was about to go through menopause. And she was like, I'm eating super healthy, and they were primarily eating like vegan or vegetarian. Which was, her husband was like doing great, losing weight, but she's like, I'm like gaining weight and I'm like exercising more. And so we went back and looked at her protein intake, and she was probably getting 50, maybe 60 grams a day, which would be almost like technically what I think like the USDA or FDA would recommend. And I'm like, this is for like what the activity you're doing, this is like definitely not enough. And so I think, we talked about like sources of protein that she could integrate and like increase. and increase the amount she was eating per day, and then to support that like muscle mass. Because she's like, my husband's doing great, he's losing weight, but I'm like gaining. It doesn't make sense. So I think just shows how individualized it is, but also the difference for men and women, and the importance of protein as we age.
Great, yeah, no, these are good answers. I always like to tell my patients the analogy, our muscles are like sponges for blood sugar. So obviously the more mass we have is ideal, but also just using them after a meal, going for a walk after a meal. Several really good studies that show that that helps with blood sugar. All right, next question we have is, there are many evidences and scientific proofs to natural medicines, holistic medicines, and many things understood in conventional medicine that are under-evaluated. Why are they not considered in conventional medicine? So I think kind of the gist of this question is, why are things not, why are alternative practices maybe not considered as much in traditional medicine or, Western medicine? I think Serena kind of touched on this a little bit when you were speaking to the idea that if it hasn't been studied, sometimes people don't want to incorporate it. But I agree with you. I think about the risks and benefits and weigh them. And what we know is, an intervention that's going to have a high risk of harm. We want to have a high amount of studies that say it's reasonable, but something that's going to have a low risk of harm, we really don't need studies to kingdom come to say that it's okay to do.
Yeah, I think too, the people may not know how to counsel on it, and they may not have like experience with themselves, so they don't feel comfortable educating on that, and giving that as like the treatment. I think also these treatments take time. So even if there are like studies that, or like evidence that shows like it's effective, a lot of these things, like it's not just like, oh, here's a pill, like you take this, then you see the result. They take time, which requires like maybe longer visits to provide that education, more follow-ups, and actual like accountability with patients. And so I think the way our system is set up, it's really hard to do that. So another plug for a DPC type model. Yeah, so that's like another probably challenge. And I think
it's also continue. Okay. I think also the quality of evidence is just hard to gather. Like it's physically hard doing these studies. And so the evidence is hard to prove anything really, because it's hard to control what someone is eating or like how much someone's sleeping for years, right? It's almost impossible to control for all of that. And so there are studies, but I think a lot of, more conventional people, they're like, oh, they're not good enough for us, kind of is the kind of sentiment a bit. Which is unfortunate because it's just kind of the nature of trying to study lifestyle modifications and like things like that I think are more studied and are more accepted are actually something like acupuncture, right? That's something very measurable. Or like Reiki, there's a lot more studies coming out about that. Like how many sessions are you going to? How many, like it's more measurable. Whereas something like diet, I mean, even me, who I have like super clean diet, there are times when I'm not, right? And so how do you factor in those moments where you're not eating like perfectly? Like no person is going to eat 100% of the time exactly how you've told them in a study. So I think that's another.
Yeah, I think I forgot who the doctor's name was when I went to this integrative medicine conference. But I remember him presenting his research on like gut microbiome and certain foods and stuff like that. And I was like really impressed because I think he clearly had thought out his research in a way that would sort of eliminate as many confounding factors as possible. And so basically, I think in order for us to advance in this, like there does need to be more creativity involved in the way that we design these research studies so that, yeah, it can be like better validated, I guess. I also, yeah, I think what Fiona brought up earlier with the money, I think that's probably a big part of it too. It just doesn't make money. A lot of these interventions that are more natural. And so it's probably not, it's going to take time for it to be accepted because of that. I think that's why, even primary care as a specialty or primary care specialties are not compensated that well because they have a hard time trying to figure out ways to make those reimbursable and stuff like that. And I also think culture is a big part of it too. I think, yeah, it's just been a really long history of us versus them. I in my opinion, of like Western versus integrated medicine or Eastern medicine and all this stuff. And there was actually, I don't know if any of you know Dr. Mike on YouTube. He has his podcasts and stuff. And I like most of the stuff that he uploads. But he had a really interesting conversation with Healthy Gamer, another YouTuber who's a psychiatrist. I believe he's Indian, and he trained as a monk at some point in his life as well. And he has like a lot of experience with Ayurvedic medicine as well. And they have this conversation on Dr. Mike's podcast where it becomes, to me at least, so clear that Dr. Mike holds these like biases that I think are prevalent just amongst a lot of Western medicine practitioners in regards to more traditional types of medicine. And it was just interesting to hear Healthy Gamers kind of like break those biases down and be like, no, actually, yeah, this Ayurvedic medicine has known about these issues for a really long time and have been addressing them. And he's like, what, really? And like, it's very interesting. But yeah, just wanted to say that.
Yeah.
Also
Go ahead.
funding, just a very quick comment. Funding is not, these fields are not funded well for really good quality research that is required. And so that's the other side of money. It doesn't make money, and so people aren't going to put money into it.
That can be tricky, and I think that's so much of the beauty of integrative medicine is that we kind of walk this bridge between the two worlds. And I think as there are more and more of us, will hopefully weave more and more of that infiltrating the conventional space. Let's see here, and then from Nikki, we have what advancements in medicine and anatomy as well as microbiome research do you anticipate will occur with the integration of artificial intelligence?
I think just quickly, great comment, Diane. I agree with that. That's good insight.
I agree as well.
I guess, I mean, I don't know too much about how AI will be integrated in medicine in general. However, I do think that being able to map more of the genomics of, say, the microbiome and have more individualized healthcare, AI can actually like support creating plans for how to bring and bridge these two worlds and use integrated practice and be able to come up with a plan that maybe one provider couldn't think of all of the possibilities and approaches. I think that could be one way.
I will say one challenge probably with AI. So I'm thinking of an AI that's used regularly, like this past year through rotations, was Open Evidence has become really popular. It's making recommendations on how to treat patients, but it's on like evidence that we have. So it's on like current research that's out there. So I think it's a really helpful tool. It provides some great answers, and we'll compare like different treatment recommendations and different evidences, but there's also limitations to that because it will be more of the conventional medicine recommendations and just based on like what has actually been studied so far.
Yeah, I think it'll be, I'm already using it a little bit in clinic. So obviously you can use it for a scribe, that type of thing, and be able to focus more on spending time with patients because it's writing the note. I'm not using that currently in clinic, but that's something I've been toying with. And then I've also been using it actually for making like personalized meal plans. So if you're a practitioner, if you use Rupa Health, they have like a beta AI to make meal plans. I've used that for a few patients and just said, here's like a nice format, a nice layout to give you some ideas of what to eat for different calorie restrictions or diet preferences, things like that. You can plug it all in and it's really nice. So I think it'll be in my opinion, covering more of the like algorithmic things that maybe we're going to be moving away from. And I think it'll free up the physician or practitioner's time to be able to be more human with the person, because that's something AI can't replace. But also to think on a more personalized level. Algorithms are great if people fit in the algorithm, but if they don't, that's where we come in and making sure that, okay, you actually shouldn't be in that algorithm. So I think it'll make our knowledge even more valuable with time. Let's see here. And then we have a question from Diane. Oh, I think the beginning part of it was at the top. Let me scroll up a little bit. Sorry, Dan. I hear holistic whole person care advertised from systems, so like healthcare systems. Is this an avenue for students to advocate for what that means to you and your patients? And then she also comments, can you utilize holistic whole person care as a theme to advocate for yourself to be good examples for the people you care for?
I think this is a huge issue. Even I've noticed even the few people that do mention diet and some things out of the traditional script, they themselves do not eat well, exercise, sleep well, manage stress well. And so I think that providers are one of the worst culprits of these issues, and to expect your patients to follow set instructions seems kind of crazy. And so, I mean, like my philosophy, and I'm sure that most people here would share that with me, is like, you live what you preach. And yet it can be really difficult. Like when you have limited time, when you are giving so much to others, it can be really hard to like take care of yourself. So I think that is a huge issue that physicians run into, and leads to burnout, which is a huge problem on every level of the healthcare field, whether it's students or residents or practicing people. And so I don't know the answer. I think the problem is it's so individual, like taking care of a patient, right? Everyone has their own way of like self-care. And that can be manifest in different ways. For me, like exercise, nutrition, really important. Sleep, but at the same time, you can't do it all. So that's also hard. But yeah, like you will never see me ever drink a soda. I see a daily physicians drinking tons of soda. And I'm like, that's such a basic thing, right? It's bad. There's nothing good about soda, right? And so that's something that, people are like, oh, it's like the only good thing in my life, or it's the only the only thing I look forward to a day. And like, that's sad, one. But two, it's, it's important to create practices early on, like what I'm doing, right? I'm working out, I'm making cooking and all that stuff a priority now. Set myself up for success in the future. So yeah, I think it starts as early as possible.
Yeah, I am definitely guilty of being probably one of those people who have not taken care of themselves well enough, just in my history. But I want to make that, yeah, I don't want to deny it, and I want to make that hopefully a strength when I'm, working with my patients in the future, that I can understand, where they're coming from, why they might not be able to incorporate certain changes in their lives, and really try to work with what they do have, and starting small, and like kind of just be their sort of mentor and partner along the way in whatever changes that they want to make. And so, yeah, and that does mean I have to put in the work myself for myself as well. So, yeah, I agree with what Fiona said.
Yeah, I think because we're all like human, it helps that if we've kind of gone through these things and like seeing how we can implement those things into our own lives, and we face challenges doing that, how we can relate to our patients, or like speak to, oh, this helped me get through this, or oh, my friend was trying to integrate this thing, this is how she got through it. So I think that's really helpful. And then doesn't exactly apply, but I was just thinking about like motivational interviewing and how like to tailor the visit and the like changes that we're making to the patient, like what will actually be beneficial for them, because we can come up with this whole list of like things that will benefit their lives, but it's like what actually do you want to focus on, will actually be most beneficial to you, and like what's one small thing we can like make a change with now. So I really like that approach to patient care as well, with like motivational interviewing.
I will say, sorry, I'm blabbing, but I do think that there are like systemic issues that are not allowing providers to take care of themselves. We're not given up enough time or resources to do so, and I think that's why I love DPC, because yeah, you get the time, you get to do your schedule the way that works for you as the provider. And so you can be the best provider that you can be for your patients. And so I'm a big fan.
Yep. It requires a lot of planning. And like I've talked to friends about it. I'm like, I make this like 2 meals, like big meals this week. And then like before I go to bed, I put it in a pot. And then in the morning when I wake up, I put the pot on the stove and I get ready. Like it requires a lot of planning, and it can be hard to keep up. And sometimes like today I ate my lunch in the locker room in 2 minutes. Like that's disturbing. But that is like I'm fueling myself with good food. It was not mindfully eaten, but however, there are some things that need to give, and so you still need to like get through the day at the same time.
Last thing I'll say too, I was thinking, just thinking about the DPC model with my Dr. Wilson, the one I work with in neuromuscular. He's like, if you like, for me, if I do end up in like a traditional healthcare system, he's like, you can really advocate for more time with patients. You can say like, no, I need a 40-minute appointment because I'm going to see patients that no one else really wants to see and address problems that no one else really wants to address. So he's like, you can really try to advocate for that. And depending on the system, like they may say yes or no, but I thought that was like something I hadn't really thought about as like a possibility. So that was encouraging if I, did want to work within a larger healthcare system too.
Yeah, I think that's a great point. Some degree of self-advocacy, and I think one of the mantras I really like is at the end of the day, everyone's doing their best. So we're all, learning as we go along, and I think using that experience of medical school and residency, and those are tough times, but patients will come to you and they're going through tough times, so you can coach them more effectively because you've been in that place before. So really make a difference. Awesome. Well, as Diane said, yeah, you're trendsetter students, so absolutely love getting to hear from you. This has been very inspiring for me and hopefully for everyone else listening tonight. Peter, do you have some closing remarks?
I do. The first one is, well, thank you all for great presentations and dialogue. This is exactly what we were looking for. But from the co-director's corner here, I just want to say that it seems evident that all three of you want to include acupuncture and perhaps Eastern medicine in your practices. And so, when you get to that point, look me up, because I'd be honored to participate in any one of your practices or all three of them. So if I'm available, I'll be happy to join. Another thing I wanted to say, though, is that, in terms of the education piece, I obviously, yeah, I mean, agree with all of you. Western medicine education is never going to be able to incorporate all of the stuff that you would like it to, but it could do a better job, right? There could be more of it. But that is also why we have things like naturopathic school and oriental medicine schools. So, because, to really plunge into that stuff and do it fully, you can't do both of those things at the same time with the same commitment, But again, I think that Western medicine education could certainly incorporate more, and you guys are kind of like pushing that, and you run into the resistance that you run into. But hopefully there will be an evolution over time, and we'll see more of it. And also on a positive note, in terms of practice, not education, I think it's great that our two big hospital systems here have departments or centers for integrative medicine and functional medicine. And not only here in Cleveland, but really at this point, dozens of hospital systems all over the country. In fact, I think almost every major hospital system in the country at least has some minimal department of integrative medicine. So this is all like really a positive trend, right? And the last thing I want to say is, the last thing I have time to say, I'd like to say a lot more. But I wasn't part of the panel, so I had to bite my tongue. The whole thing about research, if you're on my side of the fence, there is so much. There's tons and tons and tons of research, more and more all the time. The quality is getting better. There are dozens, if not, I don't know, scores or hundreds of journals that are putting, and the emphasis from like the Eastern medicine world, and I'm sure the naturopathic world, Jacob, and every other alternative medicine, or what used to be called alternative medicine, is more about the evidence-based stuff. And so whatever can be researched is being researched. And there are meta studies. I mean, I was actually looking up something the other day. I forget if it was about Parkinson's or shingles or something. I can't remember what I was looking up. And it was just like a zillion research things out there, right? Yes, the quality of research has been in question in the past, especially, honestly, research from China is not that great a lot of the time. It seems to be biased, but there's so much being done in our country now and in other countries around the world that is of a high quality. So my point is that you're just running into knee-jerk kind of reactions when people in your world are saying, oh, but there's no evidence for this, or, there's no research. It's just all anecdotal. That's just simply not true anymore. It's like people being completely out of touch with a whole other world that they're just not familiar with. It is going on. And then finally, there's also the point of, yes, not everything is amenable to a double-blind placebo-controlled study. Not everything is. But that doesn't mean there's not good research that's available. We call Chinese medicine empirical medicine. That's what it is. It's grown up in a very systematic, well, in a kind of chaotic way, but it's been put together in a very systematic way over the centuries. And it's coherent. It's this coherent, incredibly detailed system. And not everything in there is available for double-blind studies, but empirical medicine is still good medicine. So that's what I wanted to say. So again, thank you all once again for participating. And one last thing about the chapter, anybody who is not on our mailing list and wants to be, all you have to do is go to our website, integrativecleveland.com, and just hit the join tab, and you'll see a space for filling out a 2-second form to join our mailing list, and then you'll get notifications of our events and all kinds of good stuff like that. Jacob, is there anything you want to add yourself? I guess not.
Wrong button there. Yeah, I want to just thank everybody. It was a wonderful talk. Certainly a lot of this hits in the sweet spot of what I do as a naturopathic doctor and an acupuncturist. This is my home and what I live and breathe every day. And I've been in practice for 11 years now. And I appreciate the changes that have been made over the years in incorporating these type of thought processes and trainings in the conventional medical world, because people are interested. You see your patients who are interested, and now there's always been providers interested, but they had no outlet to learn it. And so it's great to see that this is coming full circle now.
And you guys are the pioneers, so for the Western medicine education piece. So any last words from anybody? No?
Thanks for the opportunity to be part of it.
Sure.
Thank you.
Okay, well, thanks, everybody. Have a good night, and talk again.
Bye.
Thanks. Bye-bye.